Hi, Dr. Cady here at Cady Wellness Institute, and it's time this week to do for the dudes what I did for the ladies last week. So many men are aware that as they age, their testosterone levels can go down. But unfortunately for men, and yes, I realize I'm gesticulating with the syringe, I'll tell you about it in a minute. With men, there isn't a clue as there is with women that something is amiss. I mean, come on. Let's be obvious. Men do not bleed out of their rectum one time a month and then have it stop when they get to be 50. Women don't bleed out of their rectum either, but you know what they do. They menstruate. And so when menstruation stops and you have 12 months absent menses and you're around 50, and if you really want to go all in and be super conservative and check the labs and the hormones are shot, that's menopause. But for men, it's not so straightforward because us guys, our testosterone level goes down slowly with time. It's not a sudden thing that will happen. So there are two problems that guys have in terms of the male construct of andropause, or the drop of testosterone. And one of them is this misconception that the only option for your treatment is to get a shot in the butt once in a while. Now, if it's done badly, the shot in the butt is once every 2 or 3 weeks. That's not good medicine. It shoots your testosterone up and then it falls pretty quickly and you're within the therapeutic range for 2 to 3 days. The best is the shot in the butt twice a week, but that's painful. One could even say it's a pain in the butt. The other problem is that when you put testosterone from outside of the body into the body, that's called exogenous testosterone replacement. And over time, it will shrink a guy's testicles. Now, there are really two ways to put testosterone into a man's body from outside. This is one way. And then for those of you that saw the ladies' version, this is a female trocar for putting pellets in. And this is the male trocar for putting pellets in. And it's really pretty cool. A small, tiny incision is made. This trocar is put in, and the testosterone pellets are loaded up in this like rounds of ammunition in a bolt-action rifle. And in this case, you put 2 rounds in, two pellets, and then this goes in and you push it in. And then you twist it and pull out and go down another track and undo this and load it up again and push them in again and go down another track. Only one little hole, but you use multiple tracks. Anyway, this is the pellet therapy. What most people do not know is that there is a way, and it is an off-label technique, but there is a way to get a guy's testosterone to go up without shots, without pellets, and without shrinking his family jewels. I've often quipped with some of my patients that if you go on exogenous testosterone, your walnuts will be shrinking down to grapes or raisin size. You do not want this. If you have a functioning pair of testicles, it's a terrible thing to waste. And with the supply chain significant interruptions that we're having now, if you run out of testosterone, woe be unto you, because you will be worse off than before, because your testes will have shut down. So there are multiple ways to get a guy's testosterone to go up. One is shots, which everybody knows about, but it's unfortunately infrequently practiced the correct way. It should be twice a week. Otherwise, your testosterone is going to be all over the map. Or it can be creams. That's another exogenous way. Or it can be pellets. Or it can be raised endogenously with clomiphene. Now, for any of you YouTube internet skeptics out there, it's very simple how you can look this up. You go to pubmed.gov. That's like Club Med, but pubmed.gov. Go to the search box and type in clomiphene, Clomiphene, male hypogonadism. That's what you got. And then look at the papers. And paper after paper after paper will say, these guys couldn't get their wives pregnant, and we put them on clomiphene and they got their wives pregnant. Or these guys had low testosterone, we put them on clomiphene and their testosterone went up. It's a very well established phenomenon, and it is a very well established off-label use of this medication in guys if your practitioner knows what he or she is doing. So again, to recap, male andropause is not as clear as female menopause. Nothing stops suddenly. You just have a gradual fade. So there's exogenous, the shots, the pellets, the creams, and endogenous with clomiphene. And clomiphene is cheap. It is frequently compounded. It's very commonly available with a compounding pharmacy. And it works. And I will start men on clomiphene before I will start them on testosterone because it's the more conservative and responsible thing to do. Preserve the testicles for as long as they can function and not make them dependent on exogenous or from outside of the body testosterone. That's a little snippet from here about men, andropause, testosterone, and how we do it here at Cady Wellness Institute. Thanks for watching.